Good morning. Welcome back to day 2 of our workshop. It is extremely gratifying to see that any of you came back and to see that so many of you decided to come back. And we're delighted to have you. Liz and I are just going to give you a very brief overview of the day. We'll start off with some reflections from the panel moderators from yesterday. They'll reflect a little bit on what they believe they heard as some key messages from their panels. We'll then have another consumer perspective. Remember Mr. Martinez yesterday, what a powerful story that was, and it was really gratifying for me to hear that story get reflected in many of the presentations through the day. I thought that was extremely effective. We then have Eric Dishman from Intel, who flew halfway across the world to be here and give us his perspectives, and we're very happy about that. We then have some folks talking about technology. So they're just going to solve all the problems of the world for us. Hopefully not. Won't happen, but they hopefully will hear about some great tools that will help us move the world forward. We'll then be going to lunch and then trying to link home healthcare back to the larger healthcare ecosystem, and then end with our reactors who are really going to try and make sense of the last 2 days for us and do all the heavy lifting on the thinking for us. And that will take us through the day. So what I'd like to do first is invite Marguerite Leibson and Teresa Lee to come up and give us their reactions from their panels yesterday.
And while they're getting settled, I thought I'd let you know that this conference or this workshop has hit U.S. News and World Report. So U.S. News and World Report has a report on their website on this conference or on workshop.
Good morning. Well, in the afternoon, we began considering what it's going to take to get us to the ideal state, and the panel that I was privileged to moderate took on the issue of the workforce. So it began with Dr. Tom Eads of the VA, who really presented using the unique framework of the home-based primary care program to illustrate the value of a true integrated interdisciplinary working team. And one of the key messages that he made was the compelling case that illustrated the need for very robust methods of analysis going forward. And he demonstrated this with some of his information that he presented to us and just how that helps direct his program. I don't think that is new to many of us in the audience, but it certainly is a clear and compelling call that going forward we're going to need to have developed these robust processes. Certainly his comparison and contrasting between the current traditional Medicare system and the home-based primary care system, I think led all of us to a clearer understanding of just how much better it is to approach these clients at the primary care phase rather than waiting till we were needing to restore care. He also helped us focus on a targeted approach rather than a one-size-fits-all, and I think that was a compelling case to be made as well. The care is provided always to the veteran with caregiver support, and that's something that is not currently in our available reimbursed cadre of services. And the care, of course, is provided longitudinally in both clinics and in home rather than episodic the way we currently have them. Essentially, at the conclusion, we know that it's really talking about getting to the right beneficiary at the right time with the right services in the right forum to receive the care. He also talked quite a bit about providing the assistive technology and how they use that, and a well-developed interdisciplinary care transition program, which was essential and we know now is one of the areas where there is the highest risk of error occurring. I think there was more than a collective sigh in the audience when he spoke about how, regardless of where the veteran is being served, that medical record is available to them. And that is something that is woefully lacking in the industry at large. And going forward, we'll need to have that availability. I think there was more than one during the day that then validated that while their health system was on the plan, it was on one system, the home care or hospice was not. And he added to our ability to do lit searches by, by illustrating the publications that they currently have in the Journal of Geriatrics. Gail Hunt followed up and informed us regarding supporting families. She shared information that helped to raise the awareness of how we can leverage the home care staff's relationship with the caregivers, noting that the caregivers should learn from the home care staff, but cautioning us at the same time that there are two key components. There is the ability, but there is also the willingness, and without both components, the likelihood of success is questionable. Gail also provided a glimpse into the lives of these caregivers, reminding us that when the home care staff is working with caregivers in the home to absorb these new tasks, their whole lives get changed. And so some of the unintended benefits that we can get is actually, as we work with these caregivers in the home, that they now can better organize their day, better organize their time management. And that I don't think is something that immediately comes to the minds of staff. Gail also suggested some other programs to look at and directed us towards Australia, a suggestion that Robin Stone subsequently also recommends. Finally, two other points to consider from Gail as we move forward is to consider how to best use technology to move forward and to include the patient-reported outcomes as we mark and measure the effectiveness of these programs. Robin Stone from Leading Age informed us about the direct care workers and the need to avoid considering all of the different programs currently available in one collective lump, thinking that they're just variations on a theme. Likewise, she cautions, do not just think of all the different types of home care workers, home care aides, personal aides, certified nursing assistants, as simply variations on a theme, just using different titles. Each has to be understood within its own context and framework. She gave us a very realistic appraisal of the future of the home care worker and the direct care worker and the shrinking availability of caregivers going forward, as well as the evolving demographics of both the caregiver employee, and the population that they will serve. She noted that the wages relative to their peers in this sector are an issue for retention, as are the benefits and the fact that they are essentially stagnant in their positions after 10 years. She asks us to recognize the growing need and suggests that rather than the growing need for these type of direct care workers, and suggests to us that rather than considering a ladder approach, a career ladder approach, let's consider a lattice that allows the ongoing development of these direct care workers but doesn't necessarily take them out of the area that they enjoy. She also suggests for ongoing development and training is an issue, particularly in the world of a consumer-directed care, and going forward will continue to be an issue that needs to be resolved. Her solutions that she offers are competency-based training, better supervision, career advancement within the scope of the direct care worker, worker empowerment, attention to the detail of wages and benefits, and special issues training such as dementia care, comorbidity care. And finally, we heard from Henry Claypool. Henry gave us not only the patient's perspective, but really some insight into living with a disability and working with this workforce. With the independence at home and consumer-directed care, he brought forth the issue of promotory care as opposed to rehabilitative care, and talked about people with clinical training needing to help and empower the consumer and bring to bear real resources so that they're able to find value. He also asked us to consider how distinct and think, rather than thinking clinical all the time, to really begin having the conversation about functional. And instead of thinking skilled or unskilled, start to think about functional abilities. And that's a clear and compelling message. We need to change our vocabulary. In terms of framing the training, he asks us to, he challenges us to think of the options for training, and not everyone needs to be directly advancing to a nurse. He also asks us to consider the whole concept of promotory and consider managing a condition and engaging the staff. That they will need real training, and that is time-consuming, and that we need to make a commitment to that. And beyond chronic conditions, he asks us to reframe that as well and think about it in terms of diet and exercise. To recognize that these individuals are economically challenged, and when we consider them as participating in a team, that sometimes not all members of the team are considered as equal partners, and we need to encourage them to participate as full members of that team. To think about orientation and training, and finally, in order for that training to take hold, to really consider going back and looking at the architecture and the framework of how we do that training. In terms, and so there were questions afterwards, and one, I think some of the most compelling questions really talked about the components of team training, leadership, and fellowship as well. That concluded the panel, and I'd like to thank you